Hello everyone. I thought today we'd talk about a subject that can be a little bit difficult for people to understand or to talk about, and that's the topic of self-harm. Now, there are many different ways that a person can self-harm. Some are quite extreme, and some are more what we expect when someone says this person self-harms. For most people, their minds go straight to cutting, and that definitely is one of the most common things that we see. But there are many other ways, and I'm not going to detail them here because sometimes videos like this can serve as inspiration for people who are self-harming, giving them, different things to try or different ideas. And so I don't want to add to some of the challenges these people are facing. I'd rather provide the information for those of you who are providing support or someone who is self-harming who's looking for support. So the number one assumption about self-harm that is probably the most, I would say, negative and most harmful for people who are struggling with it is the assumption that people are doing it for attention. So, if we just ignore the person and their behavior, then, they're just going to stop because we're just not going to give them our attention, or they're just trying to make us, see them or trying to prove to us that we're really unhappy with what we did or whatever. And that's definitely not always the case. Actually, probably about 90% of the time, it's not. Especially if the self-harm is happening with someone who has depression or who has anxiety. The times when it may not be generally is in the presence of a personality disorder. So sometimes in those cases, it can be used to gain attention or used for other things. But if there is no personality disorder present, then it's very unlikely that the person is actually looking for attention. It is a cry for help, and people do label it that as well. But the person may not be doing it with that as their intended goal. It's definitely a sign that someone who's doing it needs help, but they're not doing it to say, help me, help me, help me. They're doing it for a number of emotionally based reasons, and they're doing it as a survival technique. So when we're thinking about self-harm, the first thing to keep in mind is that it's a symptom of something. And generally, whatever it's a symptom of has caused a lot of intense internal emotions or a lot of intense distress that the person doesn't have the tools to manage internally. And so they look for ways to get that uncomfortable feeling out. A person who isn't self-harming for any particular internal motivation, like let's say there's a self-harming group at school or a ring of them that self-harm at school, after a little while they're going to stop, because really if self-harm is not doing anything for you, it's not pleasant, and it goes against all of our internal instincts to protect ourselves. So kids may be able to do it a couple of times with their group, but if there's not a reason, if there's nothing driving it, it'll stop relatively quickly. Now, self-harm tends to happen for one of three reasons. The first reason is that the person feels dissociated or disconnected from their body in some way, shape, or form. They don't feel real, they don't feel the world is real, and then when they cause themselves some type of harm, the experience of the pain grounds them back into their body and helps them feel more real. Now, often this can come from some type of trauma history, and it could be a trauma that parents and adults around the child or the teen or even the young adult know nothing about. So just because you don't know there's a trauma there doesn't mean that therefore they mustn't be self-harming because of trauma. Now, another reason is that they feel so much internal pain and so much internal struggle and turmoil, and they don't know how to navigate it, that by cutting themselves, it causes a small release of dopamine in the brain. So it almost is like the physical pain relieves the emotional pain. And so when they cut, what'll happen usually is their internal pain will escalate and intensify to the point that they feel it is not manageable anymore, and then they will choose to cut to manage the internal distress. And then the third reason is that sometimes when a person will injure themselves or cut themselves, and if they do it in a way that allows them to see blood, it's almost like they feel that seeing the blood is like seeing a release of their own emotions. And so again, it's a way to cope with whatever is happening internally. Now, it's also important to note that even though self-harm is not necessarily a sign the person is trying to kill themselves, and in fact the person who is self-harming is more likely trying not to by using the self-harm, it does make them a higher risk for suicide, because one of the things for people that stops them from following through with suicide is fear of the pain or the physical discomfort that may come. However, if a person is cutting or injuring themselves in some other manner, they've already overcome that initial resistance to causing yourself harm. So they are more vulnerable to the idea of suicide, but it doesn't mean that just because someone self-harms that they're going to end up killing themselves. That's not how it works. Some people also report feeling that self-harm can almost be addictive, because you do that type of harm to yourself, and then your body naturally will release that little bit of a dopamine hit to kind of, normally it would help us cope with whatever happened and get through the initial occurrence so that, we're not standing there in shock. But, some people get very connected to that dopamine hit, and so they may find that they're self-harming more, or that they're falling back on it all the time, because they find that it's effective for them, or it helps them feel better. A lot of times people who self-harm will actually hide it. So it'll be done on a part of the body where other people won't notice, or they will wear long sleeves, or they will wear something that covers that area of their body all the time, whether it's weather appropriate or not. And often they will try and sneak implements that they can use to self-harm. So they might decide to, try and sneak a razor out of the bathroom, or, get their hands on a kitchen knife if nobody's watching. Now, oftentimes what will happen is parents will try and make those kinds of things inaccessible for their child. And it is something that a person may decide to try to do, but oftentimes if someone, especially a teen or a young adult, if they're determined they're going to self-harm, then there's not a whole lot you're going to be able to do to actually force them to stop. What needs to happen is they need to develop techniques in themselves to manage whatever emotion or trauma or challenge that they're dealing with, so that they're able to rely on internal resources and not external resources. So if you know someone who self-harms, if you have a child who self-harms, the first thing is get them into professional help with someone, preferably someone who has worked with self-harm before, but most psychologists have run into it with clients at least a couple of times in their career. So, if you're looking for someone who specializes in working with self-harm in teens and nobody comes up, then you could definitely contact a clinic and just say, this is what I'm dealing with. Does anybody there have experience? Often what I will recommend to clients or to parents of clients who self-harm is that they work on self-harming in, it's going to sound strange, but in as safe a way as possible. So we want to make sure that they don't actually do lasting damage to themselves while we're working on establishing these internal techniques for them to use to manage emotion. And so often I will tell clients, okay, get some rubbing alcohol pads, sterilize whatever you're going to use to cut with, sterilize the area of your arm, make sure that you have bandages with you. At what point do you need to seek medical attention? At what point can you just kind of care for it yourself? Where is it actually dangerous to self-harm in general? Where is it unlikely to become life-threatening if you self-harm in a certain area? And so my goal with that is to keep the person alive and healthy while we're working on what they need to work on, because to be quite practical, if a person ends up in hospital or passes away because of something that they inadvertently caused, then there's not a chance at all to help them. So some type of self-harm reduction is generally a good path. If you're a parent or a loved one of someone who self-harms, I really recommend picking up a book that helps you learn a little bit more about it and helps you really understand what actually is happening for this person. And it is okay to, maybe reach out to your own psychologist, or if you're a parent or a guardian, to the psychologist of your child, and just find out, based on what they've learned about your child, what can you do that can be supportive? Does it help them to talk about it with them? Is it something that as a parent, you can suggest they try their internal techniques, but when you bring it up to them directly about the self-harm, maybe they start to self-harm even more, so that might be something to avoid. So, definitely check in with whoever's working with your loved one who self-harms. And, the best thing you can do as a support person is, to remain validating and to avoid accusations or assumptions as to why the person is doing what they're doing, and to start treating them differently. So if you're a friend who finds out that your friend is self-harming, once you've gotten somebody in place to help them, it may be the best thing to do for them is to just continue to treat them like your friend and do fun things with them, and be there if they want to talk, but don't bring it up every time you see them, because their life is more than just the self-harm. If you're a parent and you've got a therapist involved, and you've had a discussion with that therapist, and you've talked to them about how appropriate it is to bring it up in conversation and these sorts of things, how often should you be checking in? If the therapist says, looking like this is a good idea, then the rest of the time treat them like you would any other child, in terms of, don't treat them like they're different than their siblings in terms of different maybe academic expectations just because they're self-harming, or different rules just because they're self-harming. Now, if the expectations or something that as a parent you're doing is inadvertently adding to the reason they're self-harming, well then obviously work on changing that is going to be important. But if that is not part of what's fueling it, then checking in with their psychologists and figuring out, how do I balance treating my child normally in terms of like their other siblings, and reacting or interacting with them, keeping the self-harm things in mind. If you are someone who self-harms, I would really encourage you to get some help. Find somebody you can talk to, somebody who can help you figure out what to do with those big emotions and how to manage them in a way that is helpful for you, so that you can move on and live a life that is happy and free from self-harm. I can tell you, as a psychologist, I do not judge people who self-harm, and most psychologists won't, because we know you're doing what you're doing because you're trying to cope with things that seem too big for you, that seem unmanageable, and you've come up with the best method you've been able to find. And it's in a way commendable that you've had the resourcefulness to choose self-harm over suicide. that you're doing your best to stay alive and to manage your life. And myself, and I'm sure other psychologists like me, would love to be able to help you manage your life in a way that actually you can be proud of, and that will help you even minimize and sometimes even reduce almost to nothing those negative internal experiences that are driving what's happening to you. So I hope this is helpful. Again, always reach out to a mental health support person if you find out someone is cutting, because things will need to be very personalized to that person. So this is just a general overview of some of the things you may want to consider, but it's definitely not something that you're going to take these suggestions and implement them yourself, or you need to have someone involved with the mental health experience to help this person out. But otherwise, hopefully that this helps somebody figure out a way to navigate through some of these challenges. And one last maybe hopeful thing for someone, if you have self-harmed in the past, is that oftentimes there are scars, or there are indicators of how you've managed to work through your emotions over the years. And I've seen people do a lot of things with those scars. Some people have gotten some amazing tattoos to cover them. I saw someone who had an amazing tattoo done in white over the scars on her arms. And your self-harm and the way you've coped for so long does not have to follow you for the rest of your life. But you may decide to keep those scars, because those scars are evidence that you've lived through some really difficult things and that you've made it out the other side. And I can encourage you that it doesn't have to be the way that it